All right, so we cleaned her up pretty nicely here. And now what I'm gonna do is I'm just gonna give her a little bit of a numbing injection, okay? Small pinch, 1, 2, 3. Make sure she's nice and numb all the way around. How are you doing over here, okay?
Mm-hmm.
So what we're gonna do is we're just gonna do a little shave. So I'm just gonna slowly remove this. Actually just a nice little thick piece here. She's probably had this her whole life, right?
Mm-hmm.
Just gonna grab the rest of it here. And if we can't really reach in here, then we can just kind of burn off those little pieces, so it will just be a little more aggressive. But I think even if we get it nice and flat, she'll be pretty happy in here. Now what we're gonna do is we're just gonna create artificial, well, like an artificial scalp. We're basically burning the top layer so that it stops bleeding. And she's gonna have a little bit of a, let me increase the settings here.
Can I work out today?
I don't usually recommend to work out after any procedure the same day. I would probably skip a day,
Okay.
24 to 48 hours. I also don't recommend to take a bath.
Okay.
Usually with this type of thing, it's kind of like when you get a boo-boo, right? And then your body forms a scab. You don't not take a shower or not jump into the bathtub. So what you can do is maybe just throw a little Vaseline on it, so that way, you know, clean it off, throw a little Vaseline on it, and then that way it's kind of nice and sealed from the water. Just because it's kind of in a tucked in area, you don't want to have. So you see a nice little scab in here, and that's going to go through the natural healing process, so the wound healing process. So your skin is going to inch in and make the scab a little bit smaller. It's going to also grow some, you know, new cells underneath, and as the wound closes from the sides and from the bottom, the scab will just simply fall off just like a regular wound.
Oh, nice.
So you can kind of just go back to normal. So we are going to do a True Sculpt treatment. And what True Sculpt Flex, there's True Sculpt ID and True Sculpt Flex. So True Sculpt ID is radio frequency heat to help tighten the skin and shrink the fat. And then True Sculpt Flex is basically, what you want to say is it's multi-directional muscle stimulation. And what it does is it basically mimics an actual workout. So, and even a little bit stronger than that, because you're recruiting all of the muscle fibers in the area that you're treating. And what you're going to do is you're going to divide the body into different muscle groups that you basically want to contour and you want to sculpt. That's why it's called True Sculpt, because you want to sculpt the body. I mean, this treatment, really the ideal candidate is the patients who are a little slimmer, on the slimmer side, want to kind of create a little bit more definition in their abs, or people who already work out and it's just they're having a hard time getting that full definition that they want, maybe bodybuilders, things like that, that just want that full six-pack and want to define it more, but no matter how many crunches they do, it's not perfect. This will kind of take it to the next level. So it does only require a minimum of really 4 sessions. Usually you can start to notice a difference within the first session, but we usually recommend 4 sessions within a 2-week time frame. This is a gel pad that protects the skin and helps conduct the electricity. This is an electricity-based treatment. So first, you don't want to really, you don't want to put any of the applicators over the bone, because you're just kind of wasting energy, okay? And we never put it on the chest, and we don't put it on the upper back, because you can disrupt the electrical conduction of the heart, okay?
That's a good tip.
So you also obviously want to make sure patients don't have, you know, any defibrillators or other devices hooked up to their body. All right, so what we're going to do is we're going to put this little sticker here, and it's nice that her arms are up because you can see kind of where her ribs are, and then you know that you're going to put the applicator below the rib, okay? So there's, you know, your 2 groups of muscles here, but we don't have to treat both. We can just start with the abdominal muscles, and And then we can do the obliques as well if we want in this area. So I can demonstrate. So there's two sides to this. I usually grab the long one first, take that one off, and leave the two short ones. Right? And then this little white patch, I usually keep it out of the way. So what I mean by that is, if I'm putting on more gel pads, just make sure this is nice. And we'll push that down with the applicator. But since you guys are here, so when you're doing this, I usually keep the white outside, not inside, because then it's going to overlap where the applicators need to go. So you're basically going to, and it's okay for the gels to overlap. So you're going to basically put it in the direction of the muscle and still try to stay under the ribs, okay?